So with the procedures in the IVF lab, it usually starts a day before. So if we're having IVF procedures, the day before we prepare for IVF. So we prepare the dishes for egg collection, the bottles for semen washing and cleaning up the lab, making sure the incubators and all the other machines are functioning as they should, as well as checking the gas cylinders and every other equipment that we need to calibrate or just make sure they're functioning right. And on the next day, we come in again, make sure the equipment is functioning as it should. And then we also clean before we start our procedures. Then now if we're starting with the semen collection, so the samples come in, and what we do is we counter check. So the semen bottles are usually labeled, and the client will also fill in a form with their details. So we counter check to make sure that the semen sample we're receiving is from this client. Then we also have to confirm with our colleague to make sure that yes, it is the client we're receiving it from. We also have lists that where the patient's names are listed. So we also counter check with that. We now do the semen analysis on the microscope. After that, if it's for insemination procedures, we put it in the centrifuge for sperm washing. When it comes to the eggs, we collect the eggs. We also have to counter check with our colleague to make sure we're collecting from the right patient, and counter check on the lists to also make sure we're collecting from the right patient. After the eggs are collected, we now label on the dish, put them in the incubator behind me for further culture and progression. And after that is done, after a few, maybe 3 to 4 hours, we now inseminate the eggs. Again, with that, we need to make sure we're inseminating the right sperm into the right egg, because you don't want to inseminate Mary's eggs with John's sperm when it's supposed to be for Jane. My name is Lumeta Ngalande, an embryologist here at Lusaka IVF and Fertility Clinic.